Hello, and welcome to Courageous Doctors, the news show for you and your doctor. On this show today, we're going to cover Obamacare updates, other important healthcare topics, and even some health safety tips. Let's get started. The CBO, the Congressional Budget Office, is predicting that 2.5 million workers will leave the workforce due to Obamacare over the next 10 years. But this is because they now have the choice with assured insurance to either work less or to work less jobs. The Wall Street Journal and the Los Angeles Times is saying that a doctor shortage may occur due to insurance companies cutting the number of doctors and hospitals in their plans. The New York Times reports from the Treasury Department that there is delays for employers now to enter Obamacare. The way it goes is if there's more than 100 employees, 70% of the employees have to be added to Obamacare now by 2015. If there's less than 100 employees, these are also delayed till 2015, and there is no requirement for under 50 employees. The New York Times says that the House Ways and Means Chair addressed the new 30-hour rule in terms of being full-time as a designation which will cause employers to cut workers and hours from the workforce. Kaiser Health News says that the price to purchase exchange plans is actually higher in rural areas. The Los Angeles Times says that only 1/3 of the college students in California are buying the California plans because they say that they're just too expensive. Wall Street Journal reports that millions are left uninsured as being Medicaid ineligible, and this is due to states not expanding Medicaid. Few people are also buying cheaper catastrophic insurance plans, and the Center for Medicaid Services is saying there's delays in implementing the 2-day rule of hospitalization on the Medicare coverage, where it currently needs 3 days to be in the hospital in order for physicians in the hospital to be paid. USA Today says the Health and Human Service Secretary announced that patients can now receive lab reports themselves without going through their doctor. Let's move on to other healthcare update news. The New Jersey Department of Health has issued a warning that there is a case of measles reported in an infant on January 20th in Passaic County. The infant was unvaccinated and had traveled overseas. The Wall Street Journal is reporting that in China, a new flu strain, H10N8, has occurred in 2 people. There is also 300 cases for the other new strain, H7N9, which we call the bird flu. And we will need to follow this pandemic trend. The Wall Street Journal has said that the water poisoning that occurred in West Virginia has now led to a nationwide discussion on the safety of our water systems. There are over 12,000 American water systems. The Washington Post says that coal ash is also poisoning the water in North Carolina. The Washington Post says that the Federal Drug and Food Administration is recalling one type of Uncle Ben's rice, which is served at schools, restaurants, and hospitals, due to a vitamin niacin poisoning. Now, niacin can give you a skin rash, headaches, and nausea. The other products containing Uncle Ben's rice in supermarkets and retail outlets are not affected. The Center for Disease has warned that travelers to the Olympics and to China may be exposed to the H7N9 bird flu, to plague, and to tuberculosis. USA Today has found that 2 new FDA-approved hepatitis C drugs will be soon available on the market. Health Day has said that a new drug for ragweed allergy, and this is very interesting, can be taken under the tongue, and this may actually replace allergy shots. Reuters has mentioned that there's something called a pill cam where you can swallow an endoscope and it'll take pictures looking for cancer polyps inside your colon. Let's move on to health safety tips. The New York Times reports on a medicine shortage, especially for intravenous injections, and a recent C-SPAN Senate hearings heard from the Deputy Federal Drug Administration Director and the Government Accountability Office. The problem is that 85% of the drugs are now generic with very little room for profit margin, and this is added to the shortage. This doesn't seem to be a problem for the more expensive drugs. The FDA is now under a congressional mandate to actively work with manufacturers to try to increase generic supplies. Health Day says that the community health workers are easing patients' return to home after hospitalization. And finally, the New York Times says that the FDA is increasing the safety of infant formulas to prevent salmonella, chronobacter, and to add proteins, vitamins, and minerals. And this concludes today's show of Courageous Doctors. Thank you for joining us. Remember that we'd like to hear from you, and please look at the screen to see how you can send us in your comments. Enjoy the rest of the month, and we'll see you next month.